Hello everybody, this is Carla Saenz, and I'm very happy to be with you in this second edition of the PAHO, WHO, CARFA, and BSEC webinar series on research ethics for the Caribbean. I am PAHO's Regional Bioethics Advisor, and I'm in charge of the Regional Program on Bioethics, which is part of the Knowledge Management, Bioethics, and Research Department of the organization. As you know well, this webinar series is a joint effort, and it's a collaboration between PAHO, the Caribbean Public Health Agency, that's CARFA, and BSEC, which is the Bioethics Society of the English-speaking Caribbean. I'm welcoming you all today from very cold Washington, D.C., where things look like that and will look actually a lot worse starting tonight, because we have another big storm coming. Again, thank you very much for being with us today. And the topic of today's discussion is what makes research with human subjects ethical. This is the second introductory talk to our webinar series. I think that the best way to approach the discussion about what makes research with human subjects ethical is thinking for a second about research, because it allows us to think what exactly we worry about this question. So what is research? It's important in this discussion we keep in mind that the goal of research is the production of generalizable knowledge. So the key message is that health research is different from medical treatment or is different from a public health intervention. Why is that the case? Because both in medical treatment or in the context of providing health care or conducting a public health intervention, we aim at the direct benefit of those that are participating in the activity. The goal of medical treatment, the goal of public health intervention this can be described as therapeutic, is to provide the best medical care or the best public health intervention to those that are participating. So medical treatment and public health intervention aim at the direct benefit of those that participate, and that can be individuals or communities. However, research is not like medical treatment and public health intervention to the extent that its main goal is not the direct benefit of participants. Research aims primarily at the production of generalizable knowledge. When we conduct a research activity, when we're working towards the production of generalizable knowledge, we might have to do things that might not benefit the participants. When we're doing research, we're trying to learn something. We do not know whether something we're testing is beneficial or not. It might be the case that it's not beneficial. And that's the nature of research, this genuine uncertainty. When we conduct research, it's possible that research participants might not be in a position to get individualized treatment or to get a targeted intervention. Because when we conduct research, we have to follow a research protocol. There are studies in which that are blinded or double-blinded. So in that situation, it wouldn't be possible for the persons running the study to actually provide the best treatment for those that are participating in the study. So because this is the nature of research, because what we aim at is the production of generalizable knowledge, there is intrinsically what we refer to as a potential for exploitation. Because as it turns out, we're using a population, we're using research participants in order to provide generalizable knowledge. That is, we're using some people in order to benefit the greater community, in order to benefit others that it's not necessarily themselves. So this raises the key question of research ethics and of ethics review in particular. Under which conditions is it ethical to use persons to produce generalizable knowledge? Under which conditions is it okay to use people to produce knowledge that will be for the benefit of others and not necessarily for themselves. So in order to answer this question, I mean, this is a question we've come to answer relatively recently in history. And as I was discussing with you last week, one of the reasons that has triggered these advances in research ethics is unfortunately the fact that we've done things wrong many times. So as a matter of fact, it's the morally absolutely abhorrent experiments in Tuskegee in the United States that led to the first formal conceptualization of ethical principles for research. That was captured in the Belmont Report, which was published in 1979. So the Belmont Report articulates three general ethical principles that are meant to guide research with human subjects. Which are these principles? The first principle is the respect for persons. So we ought to respect people because of their capacity to be autonomous, because of the fact that persons can decide for themselves. They have values, they have interests. So we have to treat them as autonomous, as capable of making their own decisions, and protect those that for whatever reason have diminished autonomy, be it because they're too young or because they've lost their autonomy. So that's the first principle, respect for persons' autonomy. The second ethical principle that guides research with human subjects is the principle of beneficence. The principle of beneficence involves two things. First, don't harm people. Don't do harm to others. The second principle is that we have to the second component of the beneficence principle is that we have to maximize potential benefits and minimize potential harms. Another way of saying this is that we have to maximize potential benefits and minimize risks. Risks are by definition potential harms. That's why it doesn't really make any sense to talk about potential risks, because risks by definition are potential. So that's the principle of beneficence. The third ethical principle that guides research with human subjects is the principle of justice. Treat people fairly. So as you're probably noticing especially with the introduction of the third principle, it's not, well, these principles I think are correct and they constitute an enormous contribution to the field of research science. It's not necessarily obvious what exactly do they dictate or what's everything that these principles dictate for ethics review of specific cases of research with human subjects. So when we go from those principles to the review of a specific research protocol, how do we know exactly what they entail? So it seems to me that it's still a little bit difficult to go from such general level of principles to a specific research protocol to assess, for example, whether a certain dose for a pediatric population is acceptable or not, or whether a certain population can be excluded or not, or how to handle the enrollment process. It seems to me that we need a little bit more help to go from the general ethical principles to the actual evaluation of the protocol. And the goal of today's presentation is to provide a way to go, not just to introduce you to the basic ethical principles, but to share with you a way to go from those general principles to the actual review process of research protocols. As you well know, and as we discussed last week, a number of important declarations and documents have been produced to guide us in this process. But what I'm using today is a way to systematize everything that is in those guidelines, like, you know, for example, the Declaration of Helsinki and the SIOMS guidelines. So I'm using the framework proposed by Zeke Emanuel, Dave Wendler, and Christine Grady that articulates what's in the guidelines. So this framework is not meant to add anything new, but it's meant to guide us through the process of ethics review, articulating all the elements that are in the international regulation, in the international guidance documents. So this framework was introduced and has in an article that was published in JAMA in 2000, and has been further revised in a number of publications, but I'm just referring to the original one. So what this framework provides is 7 key components of ethics analysis that can be used to guide ethics review. Sometimes they're referred to as principles, but I like to say the word principles for the principles in the Belmore report because they have a greater level of, they're more general. And sometimes even I have referred myself to them as 7 requirements. And while we're ethically required to examine all these components, I worry sometimes that referring to them as requirements might pass the view that our work when doing ethics review is one of like going to a checklist and making sure that we've covered every element in the checklist, because as you all know, it's not like that. So I like to refer to them as 7 components or 7 elements or 7 steps of the ethics analysis that we all should do when we do ethics review, and also that we should do when we plan our research. One of the reasons why I think that this framework is particularly useful is because it goes from the beginning to the end of the conduction of research. That is, there's a reason why these elements, these components are organized in this way. So I'm going to explain that to you. When you start planning a study, the first thing that you start thinking is about what is it that you want to study? Why is it that you want to study something? So that's why the first component is the social value of the study. That has to do with your general aims with the study. The second component is scientific validity. Once you know what is it that you would like to study and why you want to study, you start thinking about what's the scientific design that is appropriate to solve that, to answer that question. The third component is the fair subject selection. Once you have a scientifically valid protocol, you have to ask yourself, who are the subjects that you should be enrolling in this study? The fourth component is favorable risk-benefit ratio. So once you've identified the study population, you have to confirm that indeed the study you have in mind has a favor or has a positive ratio of benefits over risks. Once you've done that, you're ready to submit your study for an independent review, which constitutes the 5th component. The 6th component is the informed consent. Why? Because once your study has been approved by an ethics review committee, you're ready to enroll research participants through an informed consent process. The 7th component is respect for enrolled subjects. So once participants have been enrolled and are taking part of the study, you must ensure that those participants are being treated ethically. So that's why there's a chronological order in this framework that goes from the beginning to the end of the conduction of the study. So I'm going to say more about each of these components. The first one is social value. So when you're planning a study, or when you're doing an ethical assessment of the study, the first question that you have to ask yourself is whether this research is valuable. And what I mean by valuable, a research study is valuable if it can lead to improvements in health or well-being. Can it generate knowledge? Does this study have the potential of improving health or making the life of people better? If it doesn't even have that potential, for example, because it's asking a meaningless question, then the study cannot be ethical. So if a study that cannot possibly lead to any improvement in health or well-being cannot be ethical. Why? Because it's unethical to expose people to risks, and all studies have risks, without any prospect of benefit, either for them or for society. So if no good is going to result from this study, then it's clearly not ethical to conduct the study, because we'd be exposing people to risks without being able to gain anything from this exposure. So once that we have determined that the study has social value, that it has the potential of being beneficial, of leading to improvement in health or well-being, we start to ask ourselves whether the study is scientifically valid. So, is the study methodologically rigorous? Is it scientifically sound? Are the methods valid? Are they feasible? Are the methods that are discussed in the study, do they make it possible to answer the research question, and to answer that question in a reasonable way? Will it be possible with a scientific design that has been proposed to make any inference to achieve the goal of actually generalizing the resulting knowledge? Why is scientific validity important? Because even research that asks very socially valuable questions can be conducted in a way that's methodologically poor. And because of that, it's possible for it to lead to no benefit. So it's not enough that the study has social value. It has to be conducted in a way that's scientifically sound. Because if it's not, once again, we will be exposing people to risks without being able to learn anything from that. So that would be unethical. There's often a discussion about science and ethics, and sometimes it's suggested that science and ethics are at odds. But I want to clarify that science and ethics are not at odds. For a study with human subjects to be ethically acceptable, it needs to be scientifically valid. No study can be ethically acceptable if it's scientifically flawed. And as a matter of fact, at PAHO Ethics Review Committee, we've conducted an internal study, and we've realized that the majority of cases in which research proposals are not given approval by the Ethics Review Committee is because prompts with scientific validity. As a result of this, we should be thinking about strengthening the connection between training on ethics and training on scientific design of studies. So we're ready now to move to the third component, fair subject selection. So once we've checked that the study is scientifically valid, we have to focus our analysis on the selection of the participants. Is the selection fair? What criteria is being used to select the participants? The participants should be selected based on scientific criteria, based on whether they're the correct subjects to conduct the research or not. They should not be selected based on vulnerability, because we, for example, can take advantage of their participation or can force their participation, or privilege. People should not be excluded from the opportunity to participate in research without a valid reason. They should not be excluded from the opportunity to participate in research because they're not wealthy, for example. So when we think about selection, we have to make sure that we consider not just the selection, the reasons for selecting participants, but also the reasons for excluding participants. Specifically, when reviewing a protocol, that assessing this ethics component forces us to look very rigorously at the inclusion and exclusion criteria of the study. For example, when we assess the inclusion and exclusion criteria, we have to pay attention to whether it's possible to change those criteria in order to minimize risks, or to maximize potential benefits of the study. For example, say we're studying, and I think it's very important that both researchers and members of ethics review committees invest a good amount of time scrutinizing the inclusion and exclusion criteria. For example, if we're assessing a study of a new drug that gets eliminated through the kidneys, well, we might want to exclude from the study participants that have some sort of kidney problems because they're more vulnerable to suffering and consequences of the study. So in order to minimize the risk, we're justified in excluding that population. So we have in each case to ask us, why is it that we're including or excluding persons from participation in the study, and whether that's a valid reason or not. Scientific reasons are valid. Reasons just based on convenience or privilege are not valid. Additionally, fair subject selection requires that we assess whether there's a fair distribution of risks and potential benefits. What do I mean with this? So if we're going to conduct a study on a population A, and this study will, if successful, will lead, for example, to have a drug that will be there's no plan whatsoever to commercialize that drug with population A, but the drug is going to be commercialized for the benefit of population B, say in a different continent. Then there's an unfair distribution of risks and benefits. That's a situation in which the risks are passed to one population, while that population, we know from the get-go, has no potential from enjoying any of the benefits, because those benefits will go to another population. So that would be an example of an unfair distribution of risks and potential benefits. So once we've assessed this component of fair subject selection, we have to look even more closely to the risk-benefit profile of the study in order to determine whether the study has a positive risk-benefit ratio. As I was asking a moment ago, we have to ask ourselves whether the risks to the individuals can be minimized in order to make that ratio even greater. In the case of research, we have to also check that, for example, the risks that are part of the research study are consistent with those with the standards of clinical practice, and that participants are not deprived of any illegitimately deprived of any aspect of care, for example, that they would get outside of research. Additionally, we have to ask ourselves whether potential health-related benefits to individuals can be enhanced. So can we minimize the risk? Can we enhance the benefits? And can we make sure that the benefits overall outweigh the risk? As you will see then, I've underlined health-related benefits. Why is that the case? Because if our goal is to make sure that the benefits are greater than the risks, and given that there are benefits that are not health-related, you know, we can provide, for example, economic incentives to participate in the study, and there's really nothing intrinsically wrong with that. So, but given that we have to check that benefits are higher than the risk, and the benefits are not necessarily related to health, when we do this assessment, when we calculate this ratio, we have to focus only on the health-related benefits. Because if we don't, if we include other benefits, say, for example, the benefit of an economic incentive, it could always be possible to add the economic incentives to make it more money and more money to justify any level of risk. So the risk-benefit assessment has to be based on health-related benefits, because if it's not the case, even the very high and clearly unacceptable level of risk could be surpassed by benefits that are non-health related. So in general, the question we want to ask ourselves is whether the potential benefits to individual and society outweigh the risks. So this is another important element to ask. We're not talking about whether the potential benefits of the study compared to the risk that the individuals are going to bear, but the risk that both individual, we're not just taking into account the benefits for specific individuals, but also the benefits for society, because as we said at the very beginning, the goal of research is the production of generalizable knowledge that constitutes a benefit not only for the individuals, but for everybody else in society. One additional clarification that I want to introduce with respect to the concept of risk is that when we talk about risks, we have to make sure that we don't have a very restrictive understanding of risks. Risks are not only clinical. It's not just the risk that I suffer certain condition, or that I risk that I have, I don't know, like an episode of hypoglycemia, for example, or a headache or a bruise. Risk can be of a non-strictly medical nature, and the protocol has to be reviewed taking into account the nature of the study, so all the relevant risks are taken into account. There are informational risks, but for example, there are risks. If you think about a study like a study on gender-based violence, it might involve the risk, for example, that the perpetrator of the study, of the violence, finds out that the victim, that his victim or her victim has participated in a study and possibly disclosed information about this violent practice. So it's possible, for example, that gender-based, as a result of participating in the gender-based violence, a woman can be beaten up. So it is our job when we conduct ethics review of a study, it's our job to see how to minimize those risks. For example, in the case of of a gender-based violence, we know there are a number of ways to minimize risk. One of them is, for example, not providing pamphlets with information about helplines or other resources for victims of gender-based violence, but to provide a very small piece of paper with that information, with the relevant phone number, for example, that women can hide in their clothes. Or to have, for example, in cases when there's a survey that involves question about gender-based violence, since there's always, if those surveys are going to be conducted at the houses of the participants, it's always advisable to instruct the persons administrating the survey so they change the topic of the conversation to a more general health-related topics in case someone comes into the room. My point is that this is not there's not a definite list with all the risks that we have to take into account, but when we have to assess all the risks that the study can lead to, and find a way to maximize this ratio by maximizing the benefits and minimizing the risks. So that brings us to our next component for ethics, for the ethical assessment of research, which is the independent review of the protocol. As we were discussing last week, the researchers are not in the best position to evaluate whether their own study, with which they have so much at stake, is ethical or not. It's helpful if it's others that reviewed that the research is ethical. And by others, I mean an independent ethics review committee. As you probably noticed already, this element, independent review, is slightly different in nature from the previous ones and the next ones as well. Because this is, as it were, a procedural component, a procedural criteria that is meant to provide extra safeguard, because the point of the independent review is to assess all the things that I'm discussing with you now. And this is an element for extra safeguard that is very important in terms of social accountability of research as an institution. So the review has to be genuinely independent and has to be a very thorough analysis of the study along the lines that I've explained with you. The sixth element of our analysis should be the assessment of informed consent. So how are individuals being informed about the research? Have they been provided with all the relevant information, with the purpose of the study, the methods of the study, the risks involved in the study, the benefits, potential or actual, of the study, the alternatives in case they do not participate in the study? So a fundamental element of the informed consent is one that we don't often talk about. I don't think the informed consent provided by participants can be ethically valid if the participants are not clear about the fact that they are participating in research. So what I'm introducing is the concept of therapeutic misconception. Therapeutic misconception means that participants or potential participants are misled and they think that they're participating, that research is a therapeutic activity, while the goal of research is to obtain generalizable knowledge. If people think that the goal of the activity is to benefit themselves, then they're confused and they're not providing valid consent. So the key element of informed consent is first and foremost that people understand that they're participating in research. So as I said, that people must understand this piece of information and all the relevant pieces of information that are relevant about the study. So that involves that the burden is on investigators to produce an informed consent form, but more importantly, to carry out an informed consent process that allows for participants to understand this information and make a valid decision about whether they can participate or not. So the decision must be voluntary. They cannot be coerced into participation. They cannot be told, for example, that if they don't participate, they will no longer have medical care, etc., etc. The informed consent process also requires that we take special provisions for those that cannot provide consent on their own. For example, in the case of children, that parents provide or legal guardians provide consent for themselves, and in the case that they're able to already understand information, as for example is clear in the case of adolescents, their own assent to participate has to be requested. So before moving on, I just want to emphasize that informed consent is one of many elements of ethics review. It's not enough for one to obtain informed consent and claim that because of that the study is ethically acceptable. Informed consent is one of many elements on which the ethical character of a study depends. The next and final element that I want to discuss with you is the respect for enrolled subjects. So what happens after we consented the participants? What happens after they did whatever was necessary for them to participate in the study and either have initiated or finished their participation in the study? How are we going to protect their privacy? How are we going to protect the confidentiality of their information? Ensuring that enrolled subjects are treated with respect requires seeing that the protocol has valid, reasonable mechanisms to protect their privacy. It also requires that research participants are given the opportunity to withdraw without any penalty whatsoever from the study and without being required to even provide explanations. Additionally, because of the respect that we owe to enrolled participants, We have to make sure that the study incorporates the mechanisms to provide enrolled subjects with new information. For example, the results from the study itself and access to treatment if that's appropriate. Overall, the well-being of research participants has to be monitored, and provisions have to be included in the protocol to determine how that protection is going to be conducted and how the investigators are planning and monitoring their well-being. How are adverse reactions going to be handled? How are they going to decide, for example, if it's necessary to remove a study participants from the protocol if that's appropriate? So that is the ethical aspects of research evaluation don't end once the participants have been enrolled, but continue throughout the conduction of the study, even to the point of the completion of the study. So I want to just share with you some take-home lessons. I think that this is just a set of very specific ideas that I wanted to emphasize. Consent of participants is necessary, but it's not enough to ensure that the study is ethical. More importantly, I've provided with I've shared with you the framework developed by Emmanuel et al. To conduct ethics review of research. But you have to realize that this is not meant to be a checklist, and that there's overall no such thing as an ethics algorithm. There are different assessments made by different ethics committee, and maybe both ethical, because there's not an algorithm determining, for example, what is the only correct level, ratio of risk and benefit in a particular study. One might enhance the informed consent process and think that, well, some things are some risks are possible for potential participants to assess, while other ethics review committee, for example, might think that that's an unacceptable level of risk to provide for to offer for the consideration of potential participants overall. So there is, since ethics review, as I was discussing with you last week, supposes genuine analysis and genuine deliberation of a group. But correct ethical analysis is not necessarily one that leads always to the exact same answer. There's what I like to refer to as a scope of reasonable disagreement. And all of us who have participated in ethics review or conducted research are familiar with that, and we have to realize that we can be all invoking one set of ethical principles and requirements and still yield to different answers. One committee might think that certain information included in the informed consent form is sufficient, while other other ethics review committee might claim that a little bit more is necessary. So there's no such thing as an ethics algorithm. Finally, as I said at the beginning, I want to emphasize that ethics is not independent from science. Ethics and science are not meant to be dichotomous pair. In order to be ethical, research needs to be scientifically valid. Scientific validity is a necessary but not a sufficient condition for research to be ethical. As I said before, ethics is not compliance, and that's why it's the effort of training, getting trained on research ethics implies not only general presentations like the one I'm making today and the one I made last week for you all, but also genuine discussion of research ethics cases, because it's the one when you discuss a specific case, then your capacities to conduct ethics analysis will be sharpened. That's the reason why we're following this session with discussions on research ethics cases. You have there the schedule of our upcoming webinars, and as you know, we're using the WHO's casebook on ethical issues in international research to obtain the specific cases that we'll be discussing. The next session is in charge of Dr. Derek Aarons from CARFA, and it'll focus on the chapter number 1 entitled "What is Research?" So for next Wednesday, Dr. Derek Aarons asked me to kindly ask you to read the chapter 1. Oops. Sorry. Yes, I'm going back. I see a correction. That's for April 8th. Let me go back to the schedule and check that we have that right. I think I'm a little bit confused about the schedule. So Derek is telling me here that the next session is on April 8th. I will wait and kindly ask my colleague Edwin Belastic from the office in Trinidad to clarify that while we continue. So it says March 8th, Derek says, well, it says March 11, which is exactly in a week. Let me get this straight to you. At any rate, the next session will be on the case on research, and the case to be discussed is evaluating sexual health and family planning programs, and that is the second case in the casebook and is to be found in that link, or also, as I said to you, on the website PAHO.org/bioethics, where you have on the right tab the publications and also the mailing list that we have at PAHO. So I see a lot of activity about the schedule. I'm gonna check that myself while I give you a minute to write down your comments or questions, and I will be doing the clarification of the schedule in the next second. Thank you very much for being there, and sorry about this confusion about the schedule. I'll wait for a second for you to write your comments and questions. Oops, I'm sorry. I think I've been talking and there was no and the audio was turned off. Thanks again, Derek, for saving my day. That's a problem when I don't see you in front of me. Okay, so I'm gonna go back. I don't know when this got disconnected. Did you hear the clarification about the dates? Did you hear me answering the question about capacity to provide consent? I think that's probably what you lost. Oops. Okay, so I'm going to go again to the topic of the capacity to provide consent. I think it's a very important topic because from the ethics perspective, we always say, yes, we have to make sure that potential participants have the capacity to provide consent. And while there are cases in which it's clear that there's no capacity to provide consent, there are cases in which it might not be obvious. So we have to make sure that we can rely on the appropriate type of professional that can assess the capacities of the person, to assess understanding, for example, and that group of professionals is not tied with a study. So there's a third that a group, say for example, like a group doing consult on capacity for consent is being asked to determine whether participants might provide consent or not. So, and I think that one thing that we emphasize, we don't put enough emphasis on, is that we need to strengthen our capacities in the countries with respect to those teams. We have to make sure that we have teams that can assess whether a person can provide consent or not, and that's an empirical assessment. And in my requirement, a third party goes and asks certain questions, and here's the answer to actually check that a person that is providing consent is understanding the questions or not. So the other issue that was asked with regard to consent is the one related to Ascent. I want to emphasize that Ascent is very important. It's children might not be able to provide consent of their own. They might not be able to understand a number of elements of, for example, the risk involved in a study. But that doesn't mean that that they equal to objects. There are many things that children do understand, and we have to make sure that they're engaged in a way that is consistent with their capacity when they are asked to participate in the study. We have to ensure that Ascent is meaningful, and it's not just some sort of a corollary of consent of the parents. We have to make sure that Ascent by children is really taken into account to say, for example, if a kid does not want to participate in research. And certainly there are reasons to, in certain specific cases, so for example, highly therapeutic studies, to not base a decision on the child's views, but overall, I mean, say for example, we wouldn't tell a kid that he can do without vaccination because he doesn't like needles. So we can make the appropriate comparison in the case of research. But overall, I think we have to work on the topic of consent, of Ascent, because we have to, research teams always think that the views of the kids are not relevant. And we also have to realize that there are a number of instances, for example, with adolescent populations in which the adolescents may be the ones that are ethically that from an ethics perspective are the ones that should be providing consent. The regulations of many countries in the region have made special provisions to allow for kids, for minors between 16 and 18 to provide consent on their own on studies for example, on sexually transmitted diseases. And the rationale is that in many similar cases, I mean, these minors are providing consent on their own when they obtain treatment. So if we're, and the reason we allow that because we know that if we would ask their parents to come with them and to provide consent of the, for them in the case of treatment, these minors would most likely be foregoing medical treatment. So it's been argued, and I think correctly, that if we act in that way for the case of treatment, we should make analogous provisions in the case of research. And as I said, from the regulatory perspective, there are a number of differences. And when an ethics review committee does an ethics analysis, has to take the regulatory context into account, but also strive for what is the most ethically appropriate course of action. And additionally, to push for a discussion of the regulation itself, if we think that a regulation that is being followed can be revised. A similar situation happens in the case of minors that have children themselves. Imagine a 17-year-old person, a lady that has a baby and wants to enroll her and her child in a study. Should we go with her consent? Should we require her parents' consent? I think that these are important ethical issues that have to be assessed in the light of specific studies, taking regulations into account, but overall that there might be very good reasons to claim that in certain circumstances it's acceptable for these adolescents to provide consent on their own. So let me go back and see. So, okay. So there was the comment was also about just a second, with minor special cases of prisoners. Yes. So prisoners find themselves in a situation of vulnerability because they don't have the choice that other persons have. And I think there might be excellent reasons for conducting studies on prisoners. And the first one that comes to my mind is because there are studies that would benefit tremendously inmates of prisons. For example, studies come to my mind on tuberculosis and HIV transmission that can benefit populations that find themselves in this situation. What we have to make sure is, first, that there's a good justification for conducting the study with prisoners or with other vulnerable populations. And as I said, there's no algorithm we can list beforehand. And we have to also think that there might be good reasons to make sure that certain vulnerable populations are not excluded from participating in studies. Think about, for example, a study on a very specific cancer treatment. Should a person be excluded because he's a member, because it's in prison or not? And I think these are the kind of questions that we have to ask ourselves. As I was discussing last week, there are a number of reasons why we have to have special care with populations that are in a condition of vulnerability, but we have to refine our analysis and make sure that our conclusion is not merely that since they're vulnerable, we exclude them from participation in research. A categorical exclusion from participation in research can only increase vulnerability. So a thorough assessment is necessary in each case. I see we're about to finish. It's almost 11 a.m. I would encourage you, with respect to the last questions, I would encourage you to take a look at the question on the chapter on informed consent, and I think we have also a chapter, or at least I know for sure we have cases on vulnerable population, and certainly we'll be discussing an informed consent case on April the 8th. So, well, thank you very much for your participation. It's good to have you here again. I'm sorry about the audio problem and the confusion with the date. And I look forward to our next session with Dr. Derek Ahrens on what is research. Thanks a lot.